We're gonna start that over. No. Thank you everyone for joining us today for today's panel discussion. We have a great panel today with a lot of information, some government employees, as well as some community advocates. So without further ado, let's get started. I'll introduce myself first. My name is Hutton. I am the Deputy Director at Center for Black Equity and co-founder of the Capital Ballroom Council. And I will call you all, and I'm going to start with the first question, which is also an introduction. The question is, what is your name and what is your role in ending HIV? And we will start with Director Barnes.
Okay, I'm just going to say call me Clover, because I put on my pants one leg at a time like everybody else does every day. So my name is Clover Barnes. I am the Senior Deputy Director at the HIV AIDS, Hepatitis, STD, and Tuberculosis Administration at the DC Department of Health. We affectionately call it HAHSTA. We are the district's agency that is in charge of the HIV response and the majority of the funding that goes out around HIV from the district. My role is really I feel like to be a convener, to be a receptacle for great ideas from the community, to be an engager, and to be the voice and the executive sponsorship around innovative ideas that would help us keep people engaged, get new people diagnosed, and to get everybody virally suppressed as quickly as possible. And so that will mean that we have to have equity in the programs that we fund and provide. We will have to have a reduction of stigma. And I really believe we'll have to have some new and kind of outside of the box ideas to get us where we're going.
So thank you. Next, we have Director Khaing. Want to introduce yourself? What's your name and what is your role in ending HIV?
Good afternoon, everyone. My name is Hnin, and I'm the Acting Director of the DC Office of Human Rights. And so some of you may know our office. We adjudicate complaints of discrimination, and so as you know, this year's theme is equity. And as Clover was saying, in order to achieve equity, we have to remove barriers from exclusion. And so that's what our office does, is to help remove barriers to exclusion by adjudicating complaints of discrimination. And of course, the Human Rights Act protects a number of protected traits, I think, which we'll get into later in the discussion today. So I won't spoil the fun now and get into that later. But good to be here. Thank you.
Thank you for joining us. All right, so we're going to switch over to community now. Dr. Ravi Perry.
Hi, everybody. I'm Ravi. I'm a professor of political science at Howard University. My role in ending HIV, I believe, is everyone else's role, and that's spreading awareness and storytelling. I've been living with HIV for over 19 years now, and it does get better.
Thank you. All right, next we have Director Bowles, Japer.
Yes, thank you. Greetings, everyone. My name is Japer Bowles. I'm the Director of the Mayor's Office of LGBTQ Affairs. My pronouns are he, him, his. And our role, very similar to my colleagues up here, is to better advocate for the community, be a facilitator. And ideas. Ideas are definitely what we're looking for right now. And especially when we're looking to lean into equity, what more can we do? And we are already a leader throughout the nation, not just in LGBTQ, but also in combating the fight against HIV/AIDS. What more can we do? And my goal, my mission is to find out from you all and tell the mayor so we can get some good solutions out here, so we can better empower OHR, better empower DC Health, and of course our office. So yeah, thank you.
Thank you. And last but not least, Ms. Shareese from HIPS.
Hello everyone, my name is Shareese Mone. I am HIPS Developmental Coordinator, Fundraiser, Advocate. The list goes on and on. I am amazing at doing fundraising work. I advocate for HIV and AIDS because honestly we need to learn how to take that whisper and turn it into a shout. Not be afraid to talk about these type of situations that is happening other than COVID and other than the violence that's going on with TDOR and violence, and things go on and on and on, and it's become annual. like the solidarity. We understand standing for solidarity, but today we need to move for action. And today I want to advocate for action.
Thank you so much. So I have a list of questions, but I'm going to ask one that's not in the script. Today is World AIDS Day. And, you know, we have a representative from DC Health Department, HAHSTA here. So I'm going to ask you, Director Barnes, the theme for this year, how do you guys come up with it? Yeah, what does it really mean?
So I'm going to have you read it because I don't have it verbatim and I don't want to mess it up. You don't have it on your script either. Okay, basically, the theme is around re-engaging in care. It's putting ourselves to the test, achieving equity to end HIV. Thank you, because I didn't want to misquote it. But really what we're trying to do is to get people to go back to their care-seeking behaviors that they had before COVID and to enhance the proactive and preventive care that people need to seek. So we saw a significant decrease of about 80% in the HIV tests that occurred between 2020 and 2021 because people weren't going to the doctor. They were staying home. We saw a significant decrease in the lab reports that came to us to assess viral suppression rates in the district, and that is all because people stopped going for preventative care. They would only go to the doctor during COVID if something was really wrong, something was bleeding, they thought they had COVID because, like everybody, they were afraid to catch COVID. But now we need those habits to come back. And so we really need everybody to kind of, like COVID, you wanted to know your status, you were testing at home, you were trying to figure out where you were. We can do the same thing for HIV. So we have a testing program called Get Checked DC. You can get a test kit mailed to your house for free. You can get more than one so you and your partner can test together if that's what you would like. But you can know your status at your fingertips real time throughout the year. There's no longer a need to wait to go to the doctor. And then with the test kit comes resources. If you're HIV negative, how do you get connected to PrEP? How do you get connected to harm reduction and other prevention services to keep you HIV negative? And if your test is positive, how do you get connected to care right away? We have programs that will get you medication within the first day of diagnosis. Our goal is within the first 7 days in order to increase the rates of viral suppression. We also offer mental health counseling and all sorts of things that people might need with such a diagnosis. So we're really trying to get people to get back into the wave of testing, to get back into the preventative care that we need, to get all your other preventative care items as well. I'm just going to say that because I want the whole person to be well, not just about HIV, but you need to get your pap smears and your mammograms and your colon checks and your prostate checks and all those things, because we are at a place now where the world is opening back up and it's important for you to know your status on all things preventative, because we can work better from a prevention lens than we can from a tertiary or after you've been diagnosed or something.
Thank you so much. I definitely wanted to have you talk a little bit about that. So we're going to continue with you, actually. That's the first question. So according to data, DC has reached the next phase and plan to end the HIV epidemic. Where did we come from, and what are some key successes that got us to where we are today?
So at one point, the district had the highest HIV rate per capita in the country. And the district has come a long way. And I won't say I because I've only been here about 9 years, but the district has done a lot of work to get us to a point where we are now moving from a high incidence jurisdiction to a moderate incidence jurisdiction. And what that really means is that we're seeing significantly less new HIV infections each year. Over the past, since 2007, we've seen an 82% decrease in the HIV rates in the district. For 2021, we had 230 new infections. That's up slightly from 2020, where it was 219. We expect that number to go up still because we know people have not been tested. Normally, we do millions of HIV tests in a year. We've done thousands, which is significantly less, not hundreds of thousands, not tens of thousands. So there is a significant decrease in the number of tests that have been done, and so we anticipate that there will be an increase in the number of new infections that we see as more testing increases. Around that, though, we have innovated some great programs. So we have something called PrEP-DAP. PrEP is our pre-exposure prophylaxis program. The DAP is drug assistance program. So if you cannot afford your PrEP, you don't have insurance, you're on your parents' insurance, and you don't want them to know that you're getting on PrEP, our PrEP program can assist you with getting the medication monthly, as well as with the labs and medical fees that are associated with that. So we tried to create innovative ways to get people engaged in care that are low barrier. You can do your PrEP through a teleprep program where you only come in, you leave your specimen, you walk back out, everything else is done over a televisit if that's what you would like. But we're trying to meet you wherever you want to be, right? I hate to say where you are because we want you to be where you want to be, right? So we want to meet you where you want to be, and we want to engage you in care as best we can.
Awesome. Thank you. Thank you. So we have a follow-up question. How does equity play a role here, and is that how we met our goals?
So equity plays a role here because not everybody has access to these things. So I just talked about teleprep, but if you don't have internet, or you don't have a smartphone, or you don't have a computer, you can't tele anything, right? So how do you get there? How do we help people? Like Ryan White has all these great programs for people who are already HIV positive, but we don't have that same level of care and support around people who are high risk or at most risk for HIV and are negative at this point. And so I think equity comes in where we can create the same strength and the same complement of services for people who are most at risk for HIV and not HIV positive as we have for people who are living with HIV. I also feel like people need to know more about the services that we can provide and get that assistance. Like we provide food and support for utilities, and we provide transportation and all sorts of things through community providers, but I feel like not a lot of people always know that, and the services go underutilized. There are even ways to supplement the care that you get from Medicaid if they don't fund enough visits, let's say. Like they fund a certain number of visits typically for like mental health. Let's say they give you 6, but you need 12. We can pay for those other 6 visits so that you can get everything that you need to be where you want to be your most well self, which is what we want for all our district residents.
So thank you so much for that. All right, so we're going to switch over to Director Khaing. The DC Office of Human Rights enforces the DC Human Rights Act, which makes discrimination illegal based on 23 protected traits for people that live, visit, or work in the District of Columbia. This includes those with HIV/AIDS. Can you talk about how having these protected traits lay a foundation for DC's pathway to end the HIV epidemic?
Sure, thank you. So the DC Human Rights Act is one of the most expansive civil and human rights coverage in our nation. As you said, we now have 23 protected traits. That's just new for this year as of October 1st, 2022. Previous to that, we had 21 protected traits. So I want to talk about a couple of the new protected traits that were added that will be relevant here. But compare our protected traits to the federal coverage. It's about 6 or 7. So we are so lucky to be in the District of Columbia with 23 protected traits under the Human Rights Act. So some of the protected traits that already exist that might be relevant here is things like sex, sexual orientation, gender identity or expression, marital status, genetic information, and of course, disability. So HIV/AIDS status can be a form of disability. So we cover at the Office of Human Rights and the Human Rights Act cover 5 distinct areas: employment, housing, public accommodations or government services, educational institutions. So if you're in school, if you're seeking an employment, if you are seeking housing, if you get treated differently because of any of these protected traits I just mentioned, and those are just a few, remember there are 23 protected traits, you can file a complaint at our Office of Human Rights. So it's really important that, as you mentioned, there are a number of programs in the district. And it's important that we know about these programs, but we also have equal access to these programs, and that we don't get treated differently based on any of our, by the way, actual or perceived. Even if you don't have HIV/AIDS status, if you are perceived as having HIV or AIDS and you get treated differently because of that, that could be a discrimination claim filed at our office. So let me get back to the 2 new protected traits that I talked about initially. Those are homeless status as well as eviction record sealing. So what that means is that if somebody is in a homeless status, they cannot be treated differently because they are in a homeless status. Again, that's in employment, that's in housing, that's in schools and education, government services, and public accommodations like hotels, restaurants, bars, things of that nature. The other one is eviction record sealing, and that's really important Because now that means that if you have had a record of having an eviction record sealed, you can't be treated differently in housing for having that eviction record sealed. So you have to have equal access to that as well. So that's a brief gist of all the protections that we have in the nation's capital here in Washington, D.C., and I can talk more about some of the new laws as well.
Awesome, thank you. Well, I have a follow-up question for you. What about our seniors? Can you discuss the care for LGBTQ seniors and Seniors with HIV Amendment Act of 2020 and how OHR is leading?
Sure, thank you. I'm so glad you asked that question. We do have a new law called Care for LGBTQ plus and HIV plus seniors in long-term care facilities. So what that means, and by the way, if you're done here, we have a table outside that will have a flyer of information about this new law. So what that means is that you, again, have equal rights and access at long-term care facilities. And in fact, there are a number of new rights that are in place under the Human Rights Act with respect to this law. So some of those rights include being able to have, if a long-term care facility has rooms assigned by sex, for instance, you should be able to have a room assigned according to your sex that you identify with, or your gender that you identify with, not your assigned sex at birth. Another right that is now explicitly included in the Human Rights Act is that you should have a right to have visitors. No matter if it's same-sex partners, whatever you choose, you should have a right to having visitors as you like. There are, of course, no discrimination, no harassment with respect to long-term care facilities. So how are we going to achieve that, right? So the law says we're going to achieve that by requiring long-term care facilities to conduct trainings, to provide postings in their facilities about rights for non-discrimination. And so our office, the Office of Human Rights, is going to help by certifying people to provide training to long-term care facility providers, as well as vet their posters to make sure that they in fact reflect all the accurate information that we need to have in those posters. And we're going to check on them to make sure it's being done.
Awesome, thank you so much. All right, so next I have a question for Dr. Perry. We know that it's going to take more than DC Health and our partners here to end the HIV epidemic. In January, there will be a divided government on the Hill, and House Republicans have been characterized as increasingly extreme. Do you think there's a risk of the federal government decreasing or reallocating funding to end the HIV epidemic? If so, what can we do to safeguard that support in DC?
I really appreciate that question because HIV policy matters. And we are fortunate to live in a district that has a lot of protections, but those protections also need to be enforced. The federal government can, should they choose, via Congress, choose to eliminate any HIV dollars going towards states and communities. Sometimes that is done through grants, sometimes it's done through what's known as community development block grant programs that go to neighborhood centers and communities. But there's a variety of ways in which we as a country fund our HIV investments. We have seen an increase over the last decade, I should emphasize, in federal government funding toward HIV and or AIDS in general. But that increase has not kept pace with the increase in the number of infections, particularly that are affecting Black men who have sex with men who live in the South. And so while more money is being given from the federal government to HIV and AIDS, the question is, where is that money going? Most people who receive HIV services receive them through local community groups and organizations. Those organizations are usually nonprofits that need funding to stay afloat. So when you knock on the door, someone answers it. And when you need care, there's someone there to give you that care. And we're here in the district. Obviously, Us Helping Us is the oldest Black-facing HIV/AIDS organization in the world, and was the first to receive CDC funding in the early 1980s. And that gala is tonight at 6 o'clock. And encourage people to support those kinds of efforts. But the federal policy shifting because of partisanship is a concern. We have not seen the modern Republican Party cut HIV and AIDS funding over the past in the 21st century. In fact, we saw it increased under President Bush and under President Trump. So it's unlikely that they will decrease HIV and AIDS funding, but whether or not the new House leadership puts forward additional opportunities to make the access to care more easy for individuals, that is something that we have not seen Republicans necessarily invest a lot of funding in, and we've seen Democrats do that. Last thing I will say is that HIV criminalization is a thing. The federal government has had a bill sponsored by Representative Barbara Lee since 2013 called the HIV Discrimination Act, because in over 35 states in this country, you can still be penalized, arrested, thrown in jail for non-disclosure of your HIV status. Even if you did not actually transmit the virus to someone, there are people sitting in jail today because of these draconian laws. And so it would be nice to see Congress finally take up the HIV Discrimination Act, but it's been difficult to get support for it in the Democratic Party, let alone in the Republican Party. And so I don't expect the funding to change, but some of the politics around HIV will change. I certainly think that COVID has made HIV take a back seat in terms of public communications. And so that has made it more challenging perhaps for people to access services when they don't turn on their TV or their smartphones or see an ad as often as they once did about where they could access services.
Thank you, thank you.
I was just going to say, fun fact, the district is considered the South.
That's an argument a lot of people have. Actually, this question is for both Director Clover and Dr. Perry. Although DC doesn't have statehood, we have a strong health department and are leading the charge to end the HIV epidemic nationwide. But what about the DC region? What tensions, political or otherwise, are there between neighboring jurisdictions?
So I'll start in saying that in the past we haven't had tensions. In my tenure, in my 9 years being here, we actually worked really closely with Maryland and Virginia's health departments to create more of a regional approach to how we look at HIV. We even have some reciprocity for certain programs where anybody who lives in what we call our eligible metropolitan area, which includes 5 counties in Maryland, 11 counties in Virginia, 6 independent cities in Virginia, 2 counties in West Virginia, can get services anywhere in that. So if you live in DC but you work in Virginia, you can get a service in Virginia. If you live in West Virginia but you work in DC, you can get a service in DC. And the federal dollars that we use to fund those programs say that those programs have to be equitable, or there has to be parity throughout the EMA, so that anybody who lives in an EMA can get the same quality of service and the same types of service that they need. I think I'm afraid, I won't say that this has happened, but I'm afraid that the change in leadership in Virginia might create some tensions or some changes in policies that may create different levels of service where the service in Virginia might change. So right now we work to get all of our requirements the same, all of the eligibility requirements are the same. And sometimes when leadership changes, because we have 4 different jurisdictions, we have 4 different sets of government, 4 different sets of laws, 4 different sets of rules, it can create incongruence in what happens. And so that hasn't happened, and I'm hopeful that it's not going to happen. But it is a risk that we are all kind of looking at and being prepared for.
Thank you.
Yeah, I'll only add that I also don't sense that there's any regional discord in terms of access to care, even given the fluctuations in area politics. So, as you know, you have an outgoing Republican administration at the gubernatorial level in Maryland, but they're being met by an incoming Democratic administration. You have a Republican administration in the gubernatorial office, governor's office in Virginia, but you have a Democratic state senate, and that anything that would change the health code would have to go through the Senate in order for it to be approved. So I don't expect significant changes, but does that mean it will be easy to coordinate services? It's never easy to coordinate services. And so as a political scientist, I mean, government is slow. Bureaucracy is difficult to often cut through the red tape. The people are amazing, but the bureaucracy is slow. And it's important to understand the distinction. And And can we get more opportunities to create, I think, regional conversations around HIV throughout the DMV that kind of makes our borders a little bit more amorphous? I think that that would be a good thing to do because obviously viruses do not care about borders. And so if we can talk about those of us who live in this region and what we can do together to end this epidemic, which is the goal. The federal government's goal is to end it by 2030, or at the very least to end the disparity that exists in the over disproportionate infection still among Black people. And if you don't know that the second largest group are Black women. 72% of women who have HIV today are Black women. This is a problem that I've seen more and more churches throughout the regions play a role. So Community Hope Church in Maryland, my church in downtown DC, Metropolitan AME. Others have taken regional roles, Alfred Street in Virginia. So we have seen churches take on that regional role, which is why I'm kind of optimistic that there's not really as much discord as there is much more opportunity to come together and perhaps use that church community to tackle some of the myths of HIV, but also the significant stigma that still exists.
So thank you. All right, the next question I have is for Director Bowles. The LGBTQIA plus community was and still is deeply impacted by the HIV epidemic. According to the most recent surveillance report, Black MSM, men who have sex with men, and MSM IDU injection drug users represent 34% of newly diagnosed HIV cases, compared to 9% of their white counterparts. What is the Mayor's Office of LGBTQ Affairs doing to address this disparity?
Yeah, thank you for the question. So, I think the biggest thing is partnerships. Our office doesn't provide services like the Department of Health, and we don't adjudicate claims like the Office of Human Rights. We really become a voice, and our goal is to empower folks. And I would hope to say throughout the tenure of this entire office, we have been dedicated towards Chocolate City, our LGBTQ Black and queer, same gender loving community. And I am dedicated towards that commitment. And again, with partnerships, what does that actually mean? Looking out into the community and partnering with folks like the Center for Black Equity, Impulse Group, partying with a purpose, trying to go out into the community and be with them and understand what the needs are, and then directly reflect that in what we're able to advocate for with the DC Health and with the Office of Human Rights and the Department of Behavioral Health and DC Jail and really all of the other 90 plus agencies to be your voice. And I'm really proud of what we have done, and I'm really excited about the future of just continuing to grow those partnerships and really empower organizations to work with the government more collaboratively. I mean, I'm just an entry point. I really am looking to make more connections on both sides, having the government be more connected to the community and having the community more connected to the government. So yeah, I say partnerships. That's what we have to do, and empowering the people that we create those partnerships with.
Awesome, thank you. I have a follow-up question for you. So you talked about government. So what can community partners do to get more focus on this issue?
Yeah, so there's actually an immediate direct action. In your seats or seats next to you, there is a QR code. If you scan this QR code, it will take you to together.dc.gov. And this is a website that the mayor is utilizing to collect big ideas. I don't know about you all, but I think a big idea is ending HIV/AIDS in the district. So please, that is one way that we can say directly to the mayor. And we can get much more specific, but even just saying that will get the attention on Ms. Clover. We'll give her more room to say, hey, we need more money. Here's some innovative things that some of our other jurisdictions are doing, or not just in the nation, but across the world. So that is one thing that we can do immediately. It's also, it's getting close to budget season. And we very much need organizations to voice what you do need. And not just now, but in the future. We're coming out of a pandemic. And especially with HIV, we have some serious issues. Thousands of tests, not millions of tests. I don't know about y'all, but after this, I'm getting tested. I hope everyone here is able to join us. We have testing on site. We need to better advocate for those things. And so voicing up, meeting with me, screaming at me, adding me on Twitter, like letting us know I'm ready, many of our other mayor's offices are ready, and not just our office, but I know that Hnin and Clover are also very much interested in hearing from the folks. And of course, empowering each other. I mean, just to face it, the community is not one-to-one. We're not all, friends and rainbows here. We do have our differences. We are a large and very diverse community, especially in DC. But I think on certain things, like ending HIV and AIDS, we can come around. And that takes empowering our full community. The white gays, we need to better recognize that this is how we end this as well. It takes all of us. So, I think voicing what is going on and what you need, because we're here to support.
Can I make 2 points?
Absolutely.
I just want to, I can't stress enough what Clover has said, for instance, about how we need to have knowledge around all the programs and the procedures and processes that we have in government. So what can you do as in the community? So one of the things OHR offers is what's called an HRL training, Human Rights Liaison training. You can come to those trainings to understand more about the laws that we have in those 23 protected trades and those 5 areas that I talked about. So one of the concrete ways that Director Bowles' office works with our office is to refer cases to us, to amplify our voice in understanding about the laws. And the other thing that we do throughout the year at OHR is what's called listening labs. We go out to communities and we listen to you about what some of your concerns are and connect you with government services like Clover's, even if we're not at the Department of Health or a part of HAHSTA. So come out to these events when we have them. We offer virtual versions if you can't make it in person, but come out and participate in a number of government services that we have. We are so lucky to be in the district. We have a lot of funding for these programs. Take advantage.
Thank you. All right. Next, I have a question for Ms. Monroe. Working for the
Ms. Mone.
Ms. Mone, I'm sorry. Ms. Mone, working for a leading health supportive services organization in DC, particularly one that works in communities impacted by sex work and drug use, what barriers do you encounter to your job and organization's mission?
Well, our mission is HIPS continues to provide life-saving services, advocate for health rights and dignity of marginalized communities, invest in leadership of folks with lived experience in sex work, drug use. One of the biggest barriers that I see is stigma. Stigma plays a big field in a lot of the HIV awareness, and if you don't educate yourself properly, you can find yourself in a numerous amounts of situations. A lot of times I come on the stage and I tell stories about situations of other people's services and other people's epidemic or what they're going through. And then I don't take the time to understand myself. Living in Washington, D.C., being a black woman, trans woman, and living with HIV, a lot of times I beat myself up. And I don't understand why I beat myself up so tremendously. I seek the health care, and then with body dysphoria, I don't get the proper care that I need because I'm too ashamed or too embarrassed to say that there's a bump on this side that I don't understand. So I will cover it up by saying, something about situations that can occur to make it worse, such as bleeding, such as other awarenesses that go on with your health care and HIV and AIDS. Today is World AIDS Day, and today is a day that a lot of people take for solidarity. Today I want to take this as a movement. I want to come into these events and I want to go out with information of learning more about myself, about other individuals, about the work that we do. I want to learn about how I can make the community fill this auditorium so that they can get the message, so they can get the understanding without murders or death, to celebrate something that we should already be celebrating, which is life. Understanding my purpose here. At first, I didn't know why I was on this stage. I don't have the knowledge of knowing the statistics. I don't have the education of knowing what a grant or what it takes to write a grant to put in place for the fight of HIV and AIDS. I have life experience, which makes my work even harder because now I have to have a voice. And all these whispers, I want to turn these whispers into shouts. And I want people to stand beside me and educate and understand others that are afraid to have this voice and to stand up or to sit down and to say what they have to say about barriers or about sex work or about things that they can't control or about things that they can't understand. Yes, I am a former sex worker.
Ooh. Speak.
That is one of the hardest things to do, is to say that you are HIV positive, a former sex worker. But my narratives have changed because today I advocate for sex work with the group of SWAC, advocacy, HIPS, where I can feel comfortable with knowing what my purpose is and I can make a difference in changing the narration.
Change the narrative. Yes, change that narrative.
Thank you. All right. So I have a follow-up question for you. Trying to figure out what do I follow behind that. All right. So knowing all the stakeholders in this room and those that are watching online, what more can community members, CBOs, and the government, federal and local, do to make the most impact for the communities that you work with, specifically our Black and Brown, transgender, non-conforming, and non-binary neighbors?
This is why you're here.
I was about to say the same
This is
thing.
why you're here.
I will be honest.
Yes.
Sex Workers Mutual Aid Fund. Something in place that supports trans initiative programs that invest in leadership of folks with lived experience in sex work. Honestly, sex work requires skills like providing customer service, budgeting money, scheduling dates, communicating well, and multitasking. That sounds like a whole entrepreneurship in itself. So if you have the ability to do sex work, you definitely have the ability to run your own organization and turn that narrative from a 9 p.m. at night to 5 in the morning, change it to a 9 a.m. to 5 p.m. with a 501k. All these stipends and surveys and everything. Where do the surveys go? What do we see after a survey that we took that we got the $25 stipend for? Yeah, the $25 was cute, but I need a 501k. I need a movement. I need a position where I can stand and say that I am developmental coordinator. I am a homeowner through the HPAC program here. I can stand up and say, I am taking the new medications. I no longer take pills. I take one shot every 30 days. So that tells you that I'm undetectable, that I'm living properly, I'm eating healthy, I'm working. All these take effects in order for you to fight this thing called HIV and AIDS. You have to have your stability, proper housing. Without the proper housing, how are you going to get up for an appointment for your doctor? How are you going to get up to go to work? All these things are needed and required for you to live a prosperous life. And if you don't have these things like your homelessness, that means that you're going to miss your doctor's appointment. That means someone isn't eating, someone isn't taking proper medication, someone isn't living right. How do we help them? I see these young babies, and again, this auditorium is empty. And I see these young babies running the streets, which is why I do ballroom. And I love ballroom, because it helps me to communicate with the community. It helps me stay engaged with the community. I do trick them and I do little in violence balls and kiki balls and tell you, bring me an outfit made out of condoms, and how creative they get to do runway. And bring me a shirt with your favorite organization, and they come with us helping us. They come with HIPS. They come with every type of organization here. So these are the amazing things that we have to engage in to keep the community growing. End violence, December 17th. It will be here at the Reeve Center, and it's going to be an amazing performance because it is the community showing you what they want and the community showing you what they can do and performing and showing you their talent. Like we brought this whole, it's an award ceremony honoring a lot of organizations such as Safe Haven, Marissa Miller. It is honoring so many individuals. Please, yes, find out more information and get involved with these community events because we all have a lot going on. And there's so much going on that sometimes you get blindsided and you don't understand, what do I go to, or should I choose to go to this or that? Just share it. Talk about it. Donate to it. Pass it along. That's all we ask. Thank you.
Thank you. How can we get more information?
I had a table, but I do have all the information. I have a website and everything, so stop by and see me. I'll give you a card and the information.
We'll share it widely.
Yes.
We're and a few other community partners, I'm sure, will be doing lots of advertisement, but it will be at the Reeve Center, so we'd love to see you there.
And you heard that they're community partners, so we have a partnership. Thank Jesus.
Awesome. Now I want to turn to the audience to see if the audience has any questions they would like to ask our esteemed panel. We have a few minutes left. No questions? It was a good panel, yeah? Yeah. Awesome. So we have one question. I'll come over here.
You all know I'm always good for a question. And so, Clover, this was directed to you and the role of research and that your partnership with the DC CFAR and us helping us partner there. And so, how has that helped to bring down the numbers in DC?
That's a great question, George. So the DC CFAR is the DC Center for AIDS Research. And DC is the only CFAR in the country that has a public-private partnership for our CFAR, where the health department is equally at the table as the academic institutions. And we think that is helpful because we can help inform or steer the research that is happening to something that we can actually implement. Not just for papers or posters or things for people to talk about, pie in the sky might be possible, but for things that we can actually pilot on the ground. Things that we can actually do to evolve habits or to make an impact on different communities in the district and in the surrounding area. And so having organizations like us helping us join the CFAR equally at the table as all of the other organizations is just one way that we can make sure that everybody is included and informed about the research that is happening, that the research is reflective of all of our needs and all of our diversity and differences and the way that things affect people differently. I'll give you an example. There was a birth control shot that came out a long time ago, and they had only tested it in people who were in third world countries, and so when people took it in America, they got fat because they hadn't tested it on people who eat more than just, what they ration out for food. And so research needs to be done on everybody, on the community, on everybody who's willing to participate in order to know the effects on everybody's systems and bodies. We look at things like how PrEP rolled out. It was mostly white men that were on PrEP. There's PrEP that's not even available to women. All those things can evolve if we're at the table when the research is being done, when the research proposals are being written. And that's the importance of having somebody like us helping us at the table, because they're there from the formulation of the idea and not just an afterthought at the end when you're trying to get clients in to do the research. And so I think having a seat at the table is kind of what we've all talked about here. Ms. Mone, you talked very passionately about your place at the table and how you fit in here. And I think, if I'm gonna be honest, I feel like your words were the most impactful because you have found your seat at the table, and not everybody is able to do that easily. Having a seat at the table in all of our programs and all the things that we do is what's gonna help move everything forward. So keep using your voice. I'm gonna call you to use your voice for other things as well. But that is important. People need to see you, people need to hear from you. You need to bring the community that we don't always get to impact or talk to, because that's how we're gonna move the needle, right? If we always do what we always did, we always get what we always got. My grandmother used to tell me that all the time. And what we've always done has reached a plateau. So now we have to do something different. We have to move things forward in a way that we haven't before. CFAR and research helps us do that. It helps do pilots with money that doesn't have to come from programs that are existing and working well, to try something new and to see if it works and have an evaluation of it so that we can go to funders and say, hey, look, we did this and it worked. We got, 1,500 people from Ward 8 on prep. Great. You know what I mean? And then we say this is the money that we need to scale this up. Those types of things are what's going to help us move that forward. But I think it's going to take a representation of everybody at the table to really get us over the hump. We talk about ending the HIV epidemic by 2030. It's going to take all of us. It's not me. I'm not the one that's going to make it happen. It's all of us. I see Ms. Bud sitting here in front of me. The OGs have to come, and they have lots of information that we can learn from so that we don't make the same mistakes twice. Right? We got the newbies up here, ready, innovating, whipping and snapping. We all have to move together in the same way to get over the hump. And it's going to take people like Japer, people from HRC, academia, people from the community, ballroom, all of us together, researchers. I see a lot of people in the audience. I see some of my staff, millennials, shout out to y'all, with these great ideas. They always moving and shaking. It's going to take all of that in order for us to be able to truly make an impact on the epidemic where it is now. And so I hope that you all will partner with us to make sure that happens. Hold me accountable. I'm okay with it. I'm a big girl. I can handle it. But I want you to come to us and give us your great ideas. That Together DC, I'm going to be at that event this weekend. It's important for us to get all the ideas together so that we can try to move things forward. So I'm done talking.
If I can, I only want to add from a perspective as a researcher, it is very important. I would echo everything you said. Research that actually impacts people's lives, getting more PrEP in Ward 7, Ward 8, etc. Very important. I just want to also encourage everyone that we're all researchers. And so while some of us have degrees in this stuff, all of us are researchers with what we've got access to our fingertips, Google, etc. You can go to like scholar.google.com, type in Black HIV, HIVDC, or what have you, and look up a lot of different ways in which HIV is researched, not only in terms of what we consider the improving the lives, improving the numbers, but also describing the experiences, people telling their stories, the implications of law and divinity and psychology and so many other kinds of intersections. And the internet's really available to us to inform ourselves so that when we go out in the world and we meet people, we are also better informed with the knowledge we share. There's a lot of misinformation about HIV which contributes to that stigma. And I just wanted to say, don't expect all of us researchers to do all the work. We need y'all doing some of the research for us, and yes, and bring your ideas to us, and we can help you get those ideas on paper.
Thank you. Ms. Bud, you.
Thank you so very much. I'm Early Bud, known as the Advocate. I rushed here from dialysis. I cut my dialysis short so I could be here. So one of the things that I have been forever baffled with, while I am also a CFAR member with George, he recruited me, myself and Savannah Wanza. Years ago, we had what was called the Planning Council and the Community Planning Group. And I just think that having been a part of that for 13 years until, unfortunately, Mayor Bowser came in office and somehow it was abolished. We were given awards and plaques and thanked for our service. But I thought that planning group, to me in my heart, was an opportunity for people like myself, transgenders, to come to the table. And you had many transgender people around that table that were involved. I know that I was told that they restructured everything and all that. The CFAR, it's great. But the planning council, the community planning group were really great. And, you know, the one question I have is, when are we going to go back to really focusing on prevention? I think we're there now. Prevention is key, and there needs to be some serious money put out there because we have young people who don't have to get this disease. I'm 64 years old, and I work at HIPS. And guess what? Every day, we see people coming in talking about their risk factors, getting condoms and all that, and then shortly thereafter, 6 months or 3 months later, somebody come in and say, well, I tested positive. There has to be a narrative, there has to be some funding, and there has to be something we have to do. So I don't know if it's straight to you, Clover, or whatever, but
It's all right.
I'll let you answer it because you like the bullets.
Japer put me in the hot seat, but it's okay.
Thank you so much.
So,
All right.
what I'll start by saying is that the Planning Council still exists, and there are people that are transgender people on the Planning Council. I actually was going to talk to these two after we get done about being Planning Council members. But we do have people of all representations on the Planning Council. It still exists. We meet monthly still. It still has the subgroups. There are people who work through all those groups and attend. George sometimes attends. But you is on the Planning Council. It's called the COHA now. It just has a different name. It's the Commission on Health and HIV. But it is still the Planning Council, still same rules, still same requirements. They actually look across prevention and care now. Mm-hmm. And so they are looking at that, what we're doing with the prevention funds and what that looks like, also what we're doing with the care funds and what that intersectionality or that blending looks like. At the beginning of this event, I talked a lot about prevention and about how we need to put our focus back there. Now that COVID is not the rave, right? We need to get back into knowing our status and to being tested and getting tested. And then we need to wrap around, we have some status neutral programs in the district that work to kind of funnel the same wraparound services around people who are negative and people who are positive. So that's one of the things we did with our Ryan White Part B dollars, new this year, that started in March of 2022, April of 2022, sorry, is that we created programs that are focused. Their target populations are Black men and Black women of whatever experience and whatever gender identity. But they are really looking to break down those disparities that we see in Black people in the district and really to wrap around those who are highest risk for HIV and are negative, to wrap around them the same way that we do when people seroconvert and get HIV. And so the organizations that are funded have equal money for care and prevention for those programs in order to really put an emphasis. Like I was saying, what I said in the earlier part was like we have transportation and food and all these different things once you get HIV, but we don't have any of that when you're negative. But last year we started a PrEP and housing program. So if you stay on your PrEP and you're a young person of color who is same gender loving or transgender, you can live for free in our PrEP and housing program. But you have to take PrEP, we give you counseling to get a job, to do employment counseling, education. You know, there's a case manager who works intensively with you that's right there in the building where you live. It has a garden. It's very lovely. I've been there several times. There are still openings for that. So if you know people who are homeless and are under the age of about 30, they are welcome to come to apply for that program. So this is what I mean by people don't know things are happening, right? So as part of End of the Epidemic, we have some flexibilities in the funding that we don't have in our regular funding. And so the PrEP and housing program came out of those flexibilities. And so it's majority CDC funded. They're watching it very closely. I will be honest with you about that. They've come to visit already. And it hasn't even been up for a year, but they came to visit. But the visit went lovely. They were impressed, they were pleased with how it went. And the people that are living there are happy. They were so proud to show us there, to let the CDC people in and show them how nice their living space was and how pleased they were with how they were being treated. So it's working well so far. I will say there are still openings, and it is, you do have to take your PrEP. So that's the other thing, because we're trying to keep you negative, right? And we come from a place of harm reduction, so we're not trying to make you do whatever we want you to do. We want you to do what you do. Have a good time, but do it with the least amount of harm.
What's the age?
I believe, is Fox in here? I can't see him. Oh, he's out in the hallway. I believe it's Smile runs it,
Oh,
yes.
that's
I think
18 to
it's under
20.
30.
Oh.
I think it's under 30. It's targeted at young people
Yeah.
because young MSM, black MSMs, or same gender loving men, bisexual men, however you want to call it, are our highest rate of new HIV infections.
And
So
we need
we
some for the
try
older
to-
population, over the 24, that 30, because we're seeing a lot of those.
We do, but, so I'm following the data. I've worked to get us to make data-informed decisions, right? So when our new report comes out Monday, you will see that there is a significant amount of young black MSM who are newly HIV positive in 2020.
Over 29.
And so that is where we made the age range for it. It was based on the data. So we've been trying to follow the data with what we're seeing in new rates of infection. We have some programs that are coming for black women, because we talked about the rates of HIV in black women, and that's black, trans, whatever, however you identify, as long as you're woman, those programs are open for you, right? So I don't want y'all to think that I mean cisgender women, I mean women, however you identify women. So there are things that we're trying to do to follow the data. We know that we have an aging HIV population, right? We need some programs that focus on aging with HIV. Because you all, God bless you, are living and loving and being happy and enjoying your life and living healthy lifespans, praise, right? That's what we all want. We want everybody to live a full lifespan. But with that, there are different supports that you need once you get into the senior citizen age, right? And I'm just basing that on the age, not on like how you live. And I know some senior citizens that are still finger popping as my mother. But we want you to have the supports that you need as you age as well. And so we're doing some things to work on some programs to bring here that we've seen work really well around the country. So there are things happening. We are always open to new ideas. We are always open to communication. I'm happy to come and talk to your organization. I will tell you, I'm only one person, but I will come and talk to your organization. It might take me a minute to get on the schedule, but I'm happy to have a conversation with anybody about what's happening in the district around HIV or hepatitis or STDs or tuberculosis, and to really have that open dialogue so that we can continue to engage meaningfully and make sure that everybody is getting the care and support that they need to live their best life.
Yeah.
And Ms. Bott, I'll make sure you get the email for the next call.
I'll make sure I reach out. Clover, no, I know it.
I was going to add, I had a question about the PrEP and housing program. You have to be housing insecure at the moment for that?
You do. You have to be unstably housed.
Okay.
So you can be couch surfing or, something like that. You don't have to be on the street per se, but as long as you're unstably housed. So.
Thank you. This has been a great discussion. We've been talking for over an hour, which means it's a good discussion. So before we close out, I just want to ask, for anyone watching today, here in the audience, or watching this, because this is going to be recorded and going to be shown and live forever on the internet, right? Well, what's one thing you would want that person that sees this video to know? I'll start with you, Dr. Cole.
Well, I will ask you to know that if you don't have HIV, that we need your support for those who do. And that support can come in a variety of ways. And I encourage you to look up a variety of ways in which you can help. If you do have HIV, or whether you are newly diagnosed or you're a long-term survivor, I encourage you to take care of your health and the fullness thereof, physical, mental, spiritual, what have you, so that you can live your best life. And that as you grow comfortable with your HIV status, consider sharing your story with others, because we have learned through data that when those people who are positive share their stories, it has helped to decrease infections in a lot of areas. And And so the boldness of one's own authenticity is something that I would also encourage.
Thank you, thank you, thank you. Shareese?
I would say empowerment. Empowerment with amongst family, friends, support. I'd like to just give a shout out today for the support of Ms. Bud, Shakita, and Dana. I've noticed all three of you in the audience, and I just want to say that I couldn't sit here today without you. The support, I couldn't share my truth without your support and your guidance and your love. Thank you.
Thank you.
So I will say that as I sit in this seat for almost a year, it'll be a year next week, that I want the community to engage me. Right? So I'm willing to come to you. I'm not expecting you to come to my table. I want to hear from you. I want to engage with you. I want to have meaningful dialogue. I want to hear where we do well and where we don't. I want to hear what's missing and what you feel like is needed. I spent this year trying to really get everything to understand my role, to really understand and make sure we're meeting the deliverables of the things that we're required to do. But I want to spend the next year really doing intensive sort of, I don't want to call it a needs assessment, but community engagement. And not community engagement for the sake of giving you $25 for a survey, right? That's not what I'm trying to say. I want to, like, let's have a round table. You have people, you having a ball, I want to come to the ball. I want to talk to you about what's happening. I want to get up there and see if I can do a drop. I might not get back up. You know what I'm saying? But I want to engage however y'all want me to engage, right? I can still drop a little bit. These 47-year-old knees, you know, but I want to authentically, as myself, engage with the community about what the needs are and where we can do better. And that's going to require me to come outside the office. That's going to require me to do it outside of 9 to 5. But I'm putting myself out here publicly that in 2023, I want to engage you. If that means you want to come to my office, that's fine too. But I can meet you wherever you want. And I want to come to the community. I want to talk to people who don't use our services because something went wrong. I want to talk to people who love our services but need something else. I want to talk to whoever wants to talk to me, and I want to engage you however you want to engage with me. And so that is my request for the community for the next year. And it is also my commitment that whatever we talk about and whatever we hear in those sessions, we will work to implement through our work and evolve some change and report back to you and be accountable for those things. So I guess my thing is accountability. I'm nothing if not transparent. For those of you who know me know that. But I'm going to say what I mean and mean what I say, and we're going to do that. And that, I want us to really partner, truly partner as community and government in working to end the HIV epidemic.
Thank you.
So I'm going to say two things, and one is shamefully going to be one that echoes Clover's voice. I've also been in this chair for about a year as acting director at OHR, and so one of the things I've been trying to do for OHR as well is to be more engaged with the community. So I agree with my colleagues here that we have to do this together. We are nothing without community partnership. So I also want to be more engaged, which is why we're launching these listening labs. So please come, and if you want to get in touch with me, I'll be outside after this. For those of you that are online, you can get in touch with me at ohr.dc.gov. There's the Ask the Director box. You can use that, and we'll get to me directly. The other thing I want to say is, as everyone else has been saying, let's use our voices, right? Ms. Mone has talked about sometimes you're in places in community, you don't know where to go, you don't know which events to attend, where do you get the information? One thing I want to say to empower folks is that I know you're busy. I know you're out there trying to get a number of things done. But please, if you're a victim of discrimination, use your voice, come to OHR, connect with me, connect with my manager Larry out there. Again, ohr.dc.gov. You don't need any money to come to our office. It's free. You don't need a lawyer. The difference between going to court, which by the way you can if you want, if you're a victim of discrimination, or coming to our office is that we do all the legwork. We do all the investigation for you. in looking at your claim. You don't need a lawyer to go dig up stuff for you. We'll do it for you. So please use your voice and let us know if you've been a victim of discrimination. It's really, really, really important.
Thank you.
Yeah, so I'm actually surprised no one said get tested, but it's really insane, y'all. Please get tested. That was for me. Yeah, I'm gonna say people asking for community outreach. It's community outreach. They're about to ask you all these meetings, and it's good. It's good. So please just continue to invite us to things, to invite the mayor to things. She wants to be out in the community. She is out in the community. And, we really want to hear more from the community, the good, bad, and the ugly. And, we know it's ugly out there, but if we don't address the ugly, then how are we going to make this a better world? So please continue to reach out to us, continue to be our partners, and get tested. It's World AIDS Day. Get tested regularly.
Yes.
Awesome, thank you. Thank you all for sitting with us this afternoon. If you're watching online, thank you for spending time. My name is Hutton. Thank you.